What I'm going to do is now we're going to administer oxygen. So I check the doctor's orders for the oxygen device to use and how many liters to be administered along with isolation precautions. Now remember, you can place oxygen in emergency without having to get orders, but then you have to get an order afterwards. So we want to make sure that we have, so I'm going to administer different oxygen, and one of the things that you're going to do on your checkost is you're going to have to know which device delivers percentage oxygen, because we're going to give you an oxygen percentage or liters per minute, and you're going to have to pick the right device for your checkoff. So make sure you get that correct. Okay, this says monitor pulse oximeter every 2 hours and keep O2 saturation above 93%. Like I said, I'm going to talk about the different oxygen devices and what they deliver. We're going to get our equipment, and I'm going to show you the different oxygen equipment. We need a stethoscope. We need a Aquapack or a humidifier with sterile water in it. We need a flow meter, and we're also going to use what's called nipple and nut, or another name we call in the healthcare profession is Christmas tree. And we have the different oxygen flowing devices, the Venturi mask, the non-rebreather mask, the nasal cannula, the simple face mask, and the face tent. So we'll talk about each one of those individually. Okay, so I'm getting ready to go into patient's room, so I'm going to knock on the door. Nurse saying, wash your hands, because remember, it's a federal regulation in a nursing home. They must identify yourself and where you're from when you come into the room. Hi, good afternoon. My name is Mrs. Kyle. I'm going to be your nurse today. Can you give me your name and date of birth, please? Okay, Mr. Pierce. And your date of birth, 10/3/1960. Okay, Mr. Pierce. What we're going to do here is your oxygen saturation was a little low, and you're supposed to keep it above 93%. So we're actually going to go and we're going to put oxygen on you. So we need to make sure the bed is at working height. And we only provide privacy if necessary, and pull the curtains if you're going to expose the patient. Mr. Pierce, you know what oxygen is for? Okay, you said it's to supplement for your breathing, because room air is considered as 21% oxygen, so we want to make sure. Okay, so room air is 21% oxygen, so that's what this is to supplement, because you're not getting good oxygen saturation as we would hope to, so we're going to put this device on you. So we're going to, again, assess for respiratory status, because it is an oxygenation. It is an action to put on oxygen, so intervention. So what we're going to do is we're going to check the respiratory rate, rhythm, and depth. We're going to listen to breath sounds, and also cleared auscultation, or if we're going to document if they have adventitious sounds, like wheezes, crackles, or anything like that. We're also going to look at capillary refill. We're going to look at nail bed clubbing of the nails, and they should be less than 180 degrees. And we're going to also look at capillary refill, like I said, and pulse oximetry results, which was about 90. This determines, all these things determine if they have a need for oxygen. Okay, we're going to assess, we're going to use the nasal cannula, but we're going to assess first. We're going to check and see if there's any obstruction to the nares by having the patient alternately blow out of each nostril, and we're going to make sure that the airflow is correctly. And we're going to also look behind the ears to make sure there's no there's no skin breakdown. And put the rail down so we can reach the patient a little bit better. Okay, so one of the things you have to do is we have to attach the oxygen flow meter to the oxygen source on the wall. So this is a plate that actually goes on the wall. It's green in color, just like the oxygen flow meter. So green goes into green. Do not put it into yellow, because yellow is medical air. And medical air runs compressors and things like that. Oxygen is delivered through oxygen flow meter, and it is green in color. So this oxygen flow meter gets put in the hole. Like I said, this plate will be on the wall, or you might have some portable oxygen. And once the tubing is, and then we connect the tubing. Now the flow meter here regulates how much oxygen you're getting. So we do that by righty-tighty, lefty-loosey. We turn the knob, and the ball needs to set. The middle of the ball needs to go right to the middle of the line needs to go right onto the middle of the ball for the patient. So that way we know exactly what liters per minute's on. These are called liters per minute. Anywhere from 1 to 15 liters per minute on this. Okay, so we got this together. Now, we want to attach the humidifier to the flow meter if we have anywhere from more than 2 liters of oxygen at one time. Now, that has its own device to attach it, so we want to make sure that we want to turn this on. I'm going to screw this on to the patient. Okay, we're going to screw this on to the device. Make sure righty-tighty, lefty-loosey. This will go on here, and the oxygen source will actually connect right to the, once you break this off, it will connect right to the part right here for the flow of oxygen. Now you should see, if you have a flow meter on, you should see the bubbles in the water coming up and down. So this is sterile water. Okay, if they do not have a flow meter, we're just going to use a plain Christmas tree. So again, liters per minute. So we're going to connect the Christmas tree to the, so this would be connected to the wall. This first part is nasal cannula. Nasal cannula delivers anywhere from 1 to 5 liters per minute. So this is actually in the wall. We're going to put, the cannula goes into the patient's nostrils. You're going to put it around their ears, and then once you put it around their ears, you're going to pull this up underneath the patient's neck to make sure they have oxygen. Again, this delivers 1 to 5 liters per minute. Now, because it can put pressure on the ears, so what you're going to do is you can slide, we have these things that are cut lengthwise, and you can slide them on. It also helps the patients to protect their skin from breaking down behind the ears, or you can take a couple of gauze pads, wrap it around the O2 tubing, and put it behind the ear to protect the patient's ear on both sides. So we would do that on both sides. Okay, so that's the nasal cannula. Now we have a simple face mask. Now the simple face mask needs to be put up for at least 5 to 10 liters per minute. The simple face mask gets attached, the tubing gets attached to the bottom of the device like this. This goes over the patient's head. The device goes over the nose, the bridge of the nose, so we want to make sure this metal piece can be very irritating, so one of the things we suggest is putting a piece of gauze under there to prevent pressure on the nose. And we pull up the sides of these to keep this on the patient. Keep it tightened up because you need to keep that underneath their chin to keep good airflow. These usually run about 5 to 10 liters per minute. Now most of the time we want to keep it at least above 5 because the patient, if it's not kept above 5, the patient will start retaining CO2. So that's a simple face mask. Then we have what's called the non-rebreather mask. This is the only device that you put on the patient that delivers 100% oxygen. It has holes in the side here and it allows the CO2 to escape. So when it's connected to the oxygen device, this bag inflates and they get 100% oxygen. So you put it on just like the other mask, and like I said, 100% oxygen. Then we have what's called a face tent. This is good for a patient that's actually claustrophobic, because it doesn't go right up against their face, so you can put it on just like you do with the other mask, and then it goes across here to keep it from covering the whole nose and mouth area. And of course the tubing goes in here. So this is a simple, face tent. Then we have a Venturi mask. Now the Venturi mask actually delivers a % oxygen. This gets plugged here. There's also you know what percentage by the doctor ordering it, and on here it says 40%, or it says 8 liters per minute. So you look for the device, you look on the top what the doctor's ordered, and so if he's ordered 40, then you pick the right percentage. There's like 31, 35, 40%, and different percentages. You push this on here, put this on here. This allows the condensation to drop out. This connects to oxygen tubing, and you put on like any other mask. So that's for percentage of oxygen. Now, we want to make sure that the oxygen equipment is setting up and working correctly before we leave the patient, and make sure it's delivered to prescribed rate. Now, before we leave the bedside, we're going to assess the respiratory status again. Now, there's certain oxygen therapy precautions that you need to know. Usually we post a sign that says oxygen use, because oxygen can be flammable, it can feed a fire. So we want to make sure also there's no smoking permitted near the oxygen delivery device. We want to use a 3-prong plug for electrical device to prevent sparking, and no open flames or candles near the oxygen. No electrical equipment with frayed cords or loose wires, because again it can be combustible. And especially no petroleum products like Vaseline around oxygen. You can use KY jelly, which is butter soluble, but no petroleum, because these contain acetone and it's easily ignited and flammable. I've seen people that had halos around their head because they actually got the oxygen too close to the petroleum. Secure oxygen tanks need to be in rigid stands, and secure portable oxygen cylinders and holders or carriers. So, Mr. Pierce, you're going to be using oxygen at home. And by the way, this other mask that's on here that you'll learn later on, this is a trach mask. This is for patients that have an incision into the trachea that helps to deliver the oxygen. But you'll learn that later on in a different semester. We want to make sure, if they have any questions, we want to answer their questions about oxygen therapy. And report, Mr. Pierce, if you have any shorter breath or you feel like you can't breathe, when you go home, you want to make sure that you have your family members, or the doctor or if home health are present, make sure they dial 911 immediately. When we're done, we're going to evaluate the respiratory status, rate, depth, and also the effort. And we're going to auscultate the breath sounds, like I said, before we leave the bedside. And we're going to make sure that we monitor every 2 to 4 hours as indicated, to make sure. And we're going to keep monitoring the pulse ox till the oxygen saturation comes up to 93% with the doctor's orders. Another thing we're going to do is what's called an arterial blood gas that you learned in pathophysiology and foundations class. They're going to check to see if you have how's your oxygen saturation in your blood. And we're going to keep monitoring behind the cheek, under the cheek, or the chin, on the cheeks, and also behind the ears. We're going to look for any problems with skin breakdown. And we're going to also notify the doctor of any respiratory problems or oxygen or any problems if they need prescription of oxygen before they go home. Okay, Mr. Pierce, are you doing fine? Are you short of breath? Having your oxygen on, it's helped you. It looks like your O2 sat is increased to above 90, it's 95%, so you're fine. So we're going to make sure that you don't have any, are you having any pain? You look like you have your shortness of breath. So we're going to make sure he's covered up, his body's line. We're going to put the bed up, the rail, because we don't want him to fall in bed and hurt himself. We're going to put the bed in the lowest position with the top 2 rails up. And we're going to put everything he needs close to him on the table. And Mr. Pierce, if there's anything that you need, here's your call light. You can just give me a call. You're done. And we're going to make sure that we dispose of anything we don't need. And I'm going to make sure I wash my hands before I leave the room. And report anything abnormal to the doctor. Now, I also want to go in and document, so I'm going to document the date and time and the reason the oxygen therapy was administered. And we said his O2 sat was less than 92, so we're going to make sure we document that. This is his O2 sat, and we're going to make sure that we put him on 2 liters via nasal cannula, and he had no problems with any shortness of breath after that, and his O2 sat came up too. And we're also going to document his vital signs, and his breath sounds was clear to auscultation, and his skin color was pink, and his capillary refill was less than 3 seconds, and he had no clubbing. and his respirations are even and unlabored.